Drinking too much caffeine may increase heart disease risks in healthy people. More than 4 cups of coffee or 4 energy drinks per day may raise blood pressure and heart rate. Healthy adults who drink more than 400 milligrams of caffeine per day on most days of the week may be more likely to develop heart disease, a new study found. That amount of caffeine roughly translates to about 4 cups of coffee, or 1 venti pikes roast from Starbucks, 10 cans of Coke, or 4 Red Bulls. How does caffeine impact heart rate recovery and blood pressure? Caffeine affects metabolism by stimulating the nervous system, releasing free fatty acids from fatty tissue, and increasing urination. Most studies on caffeine and heart health suggest that 400 milligrams per day or less is safe for healthy adults. Investigators designed the study to better understand how consuming a lot of caffeine on a regular basis impacted the hearts of younger adults, specifically the recovery of heart rate and blood pressure. A total of 92 randomly selected participants between 18 and 45 years old with normal blood pressure completed the study. Chronic caffeine consumption was defined as the intake of caffeinated drinks such as tea, coffee, Coke, Pepsi, coffee, and Red Bull for 5 days per week for more than 1 year. People were asked to undergo a 3-minute step test, followed by measurements of blood pressure and heart rate at both 1 minute and 5 minutes after the exercise. About 1/5 of the group, 18 people in total, reported drinking more than 400 milligrams of caffeine a day, which appeared to hinder their heart recovery and elevate their blood pressure after the step test. The subgroup of people who consumed over 600 milligrams of caffeine daily were the most likely to have an elevated heart rate over 100 beats per minute and blood pressure greater than 140/90 millimeters of mercury mmHg after 5 minutes of rest following the test. High amounts of caffeine could increase heart disease risk down the road. This study adds to our understanding that high doses of caffeine, particularly above 600 milligrams per day, may increase cardiovascular risk even in young, healthy people, possibly due to its impact on the autonomic nervous system, says Surabhi Atreya, MD, an interventional cardiologist and health sciences clinical professor at UC Davis Health in California. The study has some limitations. Right now, the study has only been presented with the abstract and not yet published as a full study in a peer-reviewed journal. And so detailed information about the number of patients they found to be in this subgroup who drank more than 600 milligrams of caffeine isn't included, says Dr. Atreya, who was not involved in the study. What is the recommended limit for caffeine intake? Based on a larger body of research evidence, it is generally recommended to keep caffeine intake to a maximum of 400 milligrams per day, which also applies to the general population without specific cardiovascular health conditions, he says. In a 2020 review published in the New England Journal of Medicine, Van Dam and his co-authors concluded that adults should limit their intake to 400 milligrams per day, and for people who are pregnant or breastfeeding, to 100 milligrams per day. High doses of caffeine could increase the risk of high blood pressure and heart problems in older adults. Although the study findings are preliminary, they suggest that regular consumption of higher doses of caffeine can affect the autonomic nervous system and create cardiovascular risk even in healthy subjects, says Atreya.